So, speaking of COVID, several Washington lawmakers and top government officials have contracted COVID-19 this week, including House Speaker Nancy Pelosi. Wei Zhang reports.
House Speaker Nancy Pelosi's positive COVID test came less than 24 hours after she was standing next to President Biden for a bill signing. That interaction followed this one on Tuesday when the 82-year-old kissed the president. White House Press Secretary Jen Psaki insisted they are not considered close contacts by the CDC.
Their definition of it is 15 minutes of contact within a set period of time and within 6 feet. It did not meet that bar.
Pelosi, who is quarantining with no symptoms, is the latest in a growing number of people close to Mr. Biden who have contracted the coronavirus in recent days, including his sister, Valerie Biden Owens, Attorney General Merrick Garland, and Commerce Secretary Gina Raimondo, all of whom attended the same Washington dinner on Saturday night. Vice President Harris's communications director also tested positive after going, adding to a mounting list of West Wing staffers. President Biden received his second booster shot last week and tested negative for COVID. The highly contagious BA2 subvariant is sweeping the nation's capital. Cases in D.C. spiked by 56% in the past week, hospitalizations by 31%. Experts say the good news is many people are protected.
We can expect more cases out there, but the vaccines are designed to keep us out of the hospital, and they're working.
Well, for more on this, we want to bring in Dr. Celine Gounder. She's a senior fellow and editor-at-large for public health at Kaiser Health News, and she's also an infectious disease specialist and epidemiologist. So glad you are here, because I got questions for you. First off, doctor, so we have this kind of explosion of cases. I feel like it started a few weeks ago, but then it's really kind of been building. What are some of the factors that may be contributing to this explosion of cases in Washington, D.C.?
Anna Marie, I think there are two main factors here. I think one is that people have let down their guard. I am, in fact, in Washington, D.C. right now for business. And I was pretty surprised looking at the restaurants and bars yesterday. They were packed. People were not masked, of course. They're eating and drinking. And the virus has not disappeared. The virus is still there. And so just because we let down our guard doesn't mean the virus somehow will disappear. I think the important thing is to understand that the vaccines really are working. So people who are double, triple, in some cases, as a case of the president, 4 times vaccinated, really are well protected against hospitalization and death. What concerns me, though, in Washington, D.C., is that we have seen this 30% increase in hospitalizations recently. And this is very likely, as we've seen in previous waves, being driven by people who are not yet vaccinated. And so that is the key message here: get vaccinated, and that's how you can return to a more normal semblance of life.
So you brought up, and I think it was in the story, that the president has received the second booster shot. So he's had 4 shots. I'm wondering, though, just how effective this additional booster shot is. Do we have any data now on what additional protection it gives you?
There is some data out of Israel that there may be a transient couple-month-long boost in your immunity, and it's really for the highest risk people. There may be some benefit to doing this to at least buy ourselves a little bit more time until we come up with other strategies, updated vaccines. So if you are over 50, anybody who's over 50 is eligible for an extra dose. We are saying that you should absolutely get that extra booster dose if you are over 65. If you're over 50 and you have chronic medical conditions like diabetes, or if you're highly immunocompromised.
The president is certainly in that bracket, and he just got the additional booster shot, so he's getting ample protection right now in case people are worried. Here's the thing, though. A lot of the people who are testing positive have either mild symptoms or no symptoms. I know that testing has gone down greatly just across the board. We used to be tested much more frequently here at CBS. Now, not as much as required. And I wonder if there's a risk of a silent spike in cases that is happening, but we're just not getting tested, so we don't know.
That's absolutely a possibility. Just in the last day, the number of people who I've heard in my own social circle who have tested positive has really spiked. I was getting dozens of texts from friends yesterday morning of, "Hey, I just tested positive. I wanted to let you know." But the good news is they were all vaccinated. Their symptoms were pretty minimal. This is exactly what the vaccines are supposed to do. They're supposed to turn this into something much milder, much more like the common cold. But it is going to make it more difficult to track the virus if we are relying on at-home tests. It means that we're going to have better surveillance systems in place, whether that's wastewater surveillance systems or random testing of the population, just to get a better estimate of how much virus is in the community. And we haven't invested in that kind of infrastructure to scale yet.
Dr. Celine Gounder, thank you so much.